Bringing life into this world in America is becoming an increasingly dangerous experience that ends in death more often than people realize. And we're not just talking about mothers here. U.S. infant deaths are increasing for the first time in more than 20 years. These issues are so pervasive. Even Democratic and Republican strategists have told me both parties are failing the American family. And that is why New York Governor Kathy Hochul says that she's proposing a plan to tackle the problem, where black women in New York City, by the way, are 9 times more likely to die from pregnancy or childbirth than white women. And Hochul is proposing a 6-point plan to tackle this. We've got it up on the screen for you to see. Really of note here is a first-of-its-kind plan to expand the state's paid family leave policy to include 40 hours of paid leave for prenatal medical appointments. So joining us to parse through the plan, whether a proposal like this could be beneficial for mothers and babies nationwide, is Dr. Greg Marchand. He's a dual board certified OBGYN. Welcome back to Scripps News Live. I want to start first with that proposed paid leave for prenatal care aspect. How much of a game changer would that be to really turn around these horrible outcomes that we've seen for mothers and particularly black moms?
Well, prenatal care is extremely important to each and every pregnancy, and indeed a great way to lower the neonatal mortality is going to be to increase prenatal care. Studies just repeatedly show that mothers who go for an insufficient number of visits for prenatal care or who don't go for prenatal care, that's just going to be a huge risk factor for poor pregnancy outcomes. And there's really a lot of different ways that prenatal care can help lower that neonatal mortality rate and prevent newborn babies from dying.
Well, Hochul's plan also focuses on addressing the mental health of mothers. You know, we think postpartum depression, and you actually shared with us earlier that postpartum actually accounts for 23% of maternal deaths. I think that's from the CDC as well. That is stunning. Can you tell us why and how?
Right. Postpartum depression is going to affect 1 in 1,000 pregnant women and can be extremely serious. The violent change of hormones that occurs after you deliver a baby, well, it really wreaks havoc on the woman's system and can cause a depression even if she didn't previously have risk factors for depression. Unfortunately, this is going to lead to a high rate of suicide. And a lot of these women are going to suffer alone or suffer in silence, not knowing that this is a well-known medical pathology and something that affects a lot of women. So it's unfortunate a lot of them may not be getting the care they need and may not realize how important postpartum visits are.
It's interesting because when you dig into her proposal, she talks about having training for basically the suicide hotline for the folks who are picking up that phone to have better ways of handling specific cases around mothers who may be calling and dealing with postpartum depression, as well as also helping train the first responders, or I should say maybe the second line defense of coming in, like lactation consultants and you know, other nurses that are visiting moms after and making sure that they're trained up as well. Do you think that kind of approach is a helpful one when it comes to mitigating this mental health component?
Absolutely. The outreach is going to be a very important part of this. I think the medical community on the whole, has really lost a lot of trust from the public after our handling of COVID-19. And I think it's up to every provider now to really reach out and show patients that we care. We're going to give them a lot of legitimate information. There's nothing to hide, and they need to know to come in for care. I have certainly seen a tremendous decrease in patients being compliant with prenatal care since the COVID pandemic. I think a lot of women might be looking for alternative medical paths to go, and some women just might be scared to go back for those visits. And as doctors, we really need to win the patient's trust back. And
that certainly applies. I mean, even in my own reporting, speaking to black mothers in particular and women of color, the mistrust in general with, you know, the medical industry is very incredibly high, and especially when it comes to pregnancy and childbirth. I want to talk about C-sections, though, because this plan wants to start regulating their use or have some oversight over that. And our Scripps News Indianapolis station actually spoke with a mother of 7 about her experience. I wanted you to hear this.
I had my first child when I was 15 years old and had my last child when I was 30. So between those seven births, I had all 7 C-sections, and wasn't really educated about the risk that was taken until my last pregnancy.
Can you walk us through what are the risks when it comes to C-sections? And when you hear about a case like hers, you know, 7 pregnancies, all C-sections, what runs through your mind?
Well, 7 is a lot of C-sections, and I'm hoping it was a skilled obstetrician that was performing those surgeries. The C-section rate in the United States continues to climb. It's actually had the first time that it didn't climb this year, sitting at about 33% overall. Unfortunately, the big factor behind that is going to be litigation. There's a fear that if you don't deliver a baby by C-section, that someone is going to come along later and say you should have, and that any problems the baby could have, even up to 18 years of age, could be the fault of the obstetrician. So I can't talk about each and every scenario, but I would guard against any women asking for an elective cesarean section. Remember, cesarean section is a major open abdominal surgery. It is not a minimally invasive surgery. So if you have the opportunity to have a vaginal delivery, I certainly would do everything to guide you down that road. Of course, that's not always the possibility. Some babies are just too big to come out. Other babies play games with the umbilical cord, and those are going to need cesarean sections. So it's very likely not your choice and nothing you could have done to prevent it if you do have a cesarean section. But I would guard against the increasing number of elective cesarean sections, especially if you're having it done for the purpose of getting tubal ligation or salpingectomy to get sterilized at the same time. I would guard against that because this is a serious abdominal surgery. Complications can occur. Other organs could be damaged. So it's something you'd like to avoid if possible.
And, it just reminds me, I remembered Ricky Lake had done a documentary about, I think it was called The Business of Being Born, and it reminded me of that. So just to hear that, the rate at this point this year for the first time didn't increase as far as C-sections are concerned is certainly a pivot there. Quickly, 30 seconds here, I want to turn to the rising rate of infants dying. The governor's plan would give families who need them safety-approved cribs for free, noting that in New York, roughly 2 infants die in an unsafe sleep setting each week. In your experience, is this something that's helpful and that would really tackle down, this infant mortality rate issue?
Yeah, I think it's a great idea to make sure that all families have a safe sleep environment for babies. SIDS unfortunately will strike a small number of infants, and the Back to Sleep program, being sure that the baby has a safe place to sleep, preferably separate from the parents, where the baby can be monitored, but also there's no possibility of an injury, as safe as can possibly be set up. That's going to be a very important component. Safety when sleeping is extremely important for newborns.
Well, we'll have to see what ends up happening with this. It's a proposal that she has to present actually today. Dr. Greg Marchand, thanks for your time and perspective. And folks, we'll be right back.